Mr. Speaker, yesterday afternoon, Bloomberg News released an analysis, district by district around America, of the highest concentration of 45 to 54-year-olds. And the reason why they did this analysis was to see and focus on where the impact of the Republican Medicare plan would land the hardest. In fact, the top 10 districts which they identified, the headline of this article, which obviously is Bloomberg News, a nonpartisan news service, is Medicare cuts would hit Republican lawmakers. 9 out of the top 10 districts in America with that highest 45 to 54 concentration are Republican districts. The 10th is the 2nd Congressional District, which I have the honor of representing in eastern Connecticut. Now, some may say, well, why was Bloomberg looking at the population of 45 to 54-year-olds? Well, the Ryan Medicare plan radically alters the Medicare program starting in 2022 for people who today are 54 years old or younger. Starting with that age group, Medicare will no longer be a guaranteed benefit, but instead will be a voucher plan where Americans will be given an $8,000 payment and told, good luck, go out and buy insurance. The Congressional Budget Office has already analyzed what that means to someone age 54 today in terms of out-of-pocket costs. In fact, it would double the out-of-pocket costs for 54 and below in year one who enroll in the Medicare program. And over time, we have an analysis which shows what the true out-of-pocket costs would be for a 55-year-old with normal American life expectancy. It would raise their out-of-pocket costs. These are additional costs by $182,000. So for anybody who's out there today who's in that age group, you better start saving up, because you're going to need a lot more retirement assets to just keep level with what an American turned 65 today gets under the Medicare program. Now, we've heard a lot, and just again, one of the speakers a few minutes before was just making the comments about Medicare going broke and that people 65 and up are going to be protected in terms of their Medicare. Wrong. The Ryan Republican plan would immediately cancel new benefits for seniors today that they've started to enjoy starting in January: annual checkups, cancer screening, smoking cessation. I had a town hall back in Norwich, Connecticut a couple days ago where I had a young primary care doctor who was talking about the fact that the new annual checkup has allowed her that extra time to spend with patients, and she's detected 3 cancers because of the fact that she now has the tools to do her job smartly and efficiently. And the Ryan Republican plan would cancel that annual checkup coverage, which the Affordable Care Act kicked in January, along with cancer screenings and along with smoking cessation. All smart, preventative, wellness-oriented care, which will save the Medicare program money. But again, for people 55 and less, and again, this chart shows how the out-of-pocket cost grows exponentially. So I see some young folks up in the audience there. If you're 15 years old, your out-of-pocket costs are going to be $711,000 higher than a 65-year-old today entering the Medicare program. What this really amounts to, the Ryan plan, is just simply a cost shift to patients and families. It does nothing to make a more efficient healthcare system, and that is not a solution for the problem. Now, we also heard, well, Medicare is going broke. It's going to be bankrupt in 2024. If you read the trustees' report, you will see that, in fact, that is a totally misleading comment. What the trustees reported was that there are sufficient funds in the program to cover 90% of the cost of Medicare starting in 2024 for at least another decade and a half. Now, that shortfall is a problem. We should not have a 10% shortfall starting in 2024, but that is a manageable problem. We can make smart, intelligent changes to the Medicare program, just like we have done going back to 1965 when it was first enacted. Again, we have had, in fact, solvency reports and warnings from the trustees that were much more dire in the 70s, in the 80s, in the 90s than the report that we saw 3 weeks ago. There is no reason to scare people and panic people into butchering the Medicare's guaranteed benefit in the name of fiscal solvency for the Medicare program. We can make smart choices. We can make smart changes. But shifting costs to people 55 and less. That's not a solution to Medicare's program. It ends Medicare. Now, within families, some who are over 55 and some who are under 55, this will create a two-tiered coverage. I can report to you the Courtney family. I'm 58 years old, so purportedly I would get the old-fashioned benefit under the Ryan plan. But my wife, Audrey, who's a nurse practitioner, she's 51. She gets the loser benefit, so she's going to have to start dishing out close to $200,000 in additional costs for her retirement under this plan. So you've got two-tiered coverage even within families under the proposal that we have with the Ryan plan. We can do better as a great nation to guarantee coverage that is a reasonable package, that is smart and efficient to solve Medicare's program. We don't need the Ryan plan, which will shift us to patients and families in an unfair fashion. I yield back.